Chapter 3, Assessing Children's Health. Information about a child's health is available in many forms and from a variety of sources. And on page 56, it lists some of those for you, such as immunization records, dental examination records, school-related injuries, the results of different screenings that have been done on the child. And of course, all of these should be kept confidential and private. Share only on a need-to-know basis and with permission. And on page 57, it gives you an example of what a release form might look like for a parent to sign if they would like to share the information your school has with other agencies or institutions. It's most effective if only one person manages health information. That way, there's not miscommunication between multiple staff members. Although information should be collaboratively collected, sometimes the teacher is more effective at getting information that the school needs than the office staff. And by law, you're supposed to retain this health information for at least 5 years before you remove it from your office. This health information can be used to assess and monitor a child's health over time. It can help you identify developmental problems, formulate intervention plans, make referrals, and work with service providers and evaluate a child's progress. Children's health histories. This is information that families provide on health history forms, and this can be useful in understanding a child. And so here we can find out things like on page 56, their daily habits, such as their eating habits, their toileting and napping habits, their family structure if they have siblings, the main language in the home, any special health conditions they might have. This can also provide us information on current developmental progress, and I think we mentioned the other two. Medical and dental records, a complete physical form, and immunization records are required for admission to early childhood and public school programs in most states, and now in California. We can no longer opt out on immunizations just because of personal preference. The only way we can opt out is for a medical reason. Also, medical records would include their height, their weight, and their basal metabolism or BMI measurements. This provides reliable information about a child's growth and well-being. Height and weight should be measured every 4 months, and you can do it in fun ways in the classrooms by maybe drawing an outline of the child's body and then measuring their height in inches, and that can be actually a math or a science lesson. When you're looking at the BMI measurements, underweight would be less than 18.5 BMI measurement. Overweight would be more than 25, and obese would be 30, more than 30. So, sensory system assessments. Young children learn primarily through their sensory organs, their eyes, their ears, their nose, their hands, and their mouth. And if one of them isn't providing all the information that's available, that can impede their development. So because teachers see groups of children functioning in a variety of situations, they can observe behaviors that families may not notice that may indicate a sensory problem. Because they see more children, they know have a better idea of what's typical. So then in regard to vision, What behaviors might suggest that an infant or toddler may be experiencing a potential vision problem? You have a whole list of behaviors available for you to look at on page 60, and these are important for us to be very aware of. And then the same thing for older children. You can find that on page 62. When it comes to professional evaluation, an optometrist is a specialist. An optometrist is not a physician, and their specialty is examining eyes and prescribing glasses and eye exercises if there are vision problems. An ophthalmologist is a specialized medical doctor, and they specialize in eye disease and abnormalities of the eyes. You can also take a look at the various vision acuity tests on page 61 of your text. Common vision disorders. Amblyopia, which is lazy eye, is an distortion and gradual loss of vision due to a muscle imbalance. And mothers who smoke during pregnancy put their children at risk for this. Strabismus is a condition in which the pupils appear crossed or not aligned equally, and this impairs motor skill development and can cause squinting. Myopia is nearsightedness, and that means that they can see better close up than far away. And a child might appear clumsy or accident prone because they can't see far away. Or hypertopia, which is farsightedness. And sometimes farsightedness can be outgrown, but what this means is they can see better far away than up close. So in regards to hearing, you can find behaviors that might indicate a potential hearing problem in an infant and toddler on page 65. And then the same type of list for older children on the same page. So what formal testing procedures are used to confirm or rule out a hearing disorder? Well, there is a universal infant hearing screening that's administers directly after birth, and you have a website page for that if you'd like to look up further information on that. And there's also preschool screenings that can be done, and these are usually completed in a play activity format. And for school age and adults, the hearing tests tend to be raising your hand when you hear a sound. And then on page 66, you'll find some of the risk factors or problems that might be associated with hearing issues in children. So an audiologist is a specialized clinician who uses non-medical methods to diagnose hearing impairment. Conductive hearing loss interferes with the ability to hear and distinguish quiet sounds, and conductive tends to be something that blocks sound from coming into the ear canal, whereas sensory neural and mixed hearing losses interfere with the child's ability to hear and or to interpret sounds, and these tend to be focused more on the internal functions of the ear. And then if you want to take a look at the physical structures of hearing, you can find a diagram and a drawing on page 67 of your book so that you can see the external and the internal structures of the ear. So on page 67 of your textbook it talks about some modification and instructional methods that teachers can implement in the classroom to help children who have hearing impairment. For example, you can reduce background noises such as music or the radio. You can bend down to the child's level to make it easier for the child to hear and understand you. Make sure you use gestures or pictures to be added to what you said, so that you give them all the information, give them a better opportunity to understand what you're trying to communicate. So speech and language. Speech is the process of using words to express thoughts. And language is an agreed upon system used for communication. And there are two types of language. There's receptive language, which comes first, and in development, children understand language before they can actually utilize it. And it is the understanding of what others are communicating to you. And then expressive language is communicating with others what you want to express your thoughts and emotions. Developmental milestones provide a functional measure for evaluating a child's speech and language progress. And so these would be averages, and you can see those on page 68 of your text. A hearing test should be the first step in assessing a child who may have a speech impairment or delay, because being able to hear has a profound impact on speech and language. So referrals for professional evaluations should be made if there are any concerns, and you can find more information on that on page 69 of your text. So we also want to take a look at nutritional assessments, and the BMI we can look for appearance and behavior, and it provides initial indicators of a child's nutritional well-being. And there are also additional assessments tools such as dietary nutrient analysis, measurements compared to norms like head circumference, and laboratory tests. So some common nutritional disorders include malnutrition, which is a lack of sufficient food or essential nutrients. And this may be caused by limited access to food or unhealthy food choices. And on page 72, you have some physical signs of malnutrition, looking at the face, eyes, lips, teeth, tongue, etc., so you know what to look for. Obesity is commonly due to a combination of too much food and calorie intake and an inactive lifestyle, not moving around enough. So when it comes to referrals, a comprehensive evaluation may be needed to identify a child's health problems. This evaluation process must take the child's family and home environment into consideration, and teachers should refer families to appropriate health professionals and support their efforts to follow through with recommendations. And make sure that you've vetted the different agencies and institutions you might refer families to, so that you know that this institution or agency will provide the kind of service that you would want your families to receive.